As one gets older, the skin of the eyelids becomes looser, and there is then a significant excess of this. This leads to the eyelids drooping, and an excess of skin can thus, in many cases, even restrict vision. This then becomes a problem, which is not aesthetic, but also functional. A plastic operation of the eyelids offers the possibility of removing this problem. Cosmetic modification of the eyelids is an operation during which the excess skin is removed along with the so-called fat pockets in the upper and lower lids. So the operation mainly modifies drooping upper lids and bags under the eyes, which are the cause of an older and more tired appearance. If your lids are sagging or you are getting those so-called bags under your eyes, doctors recommend that the operation be performed as soon as possible. The results are then significantly better and last for longer. The operation is most frequently performed on patients older than 35. The operation is usually performed under local anaesthetic. However, the operation can also be performed under narcosis if the patient or the doctor prefer this. The procedure usually takes around 1 hour. The incision is made and thus the subsequent scar on the upper lids in such a way that it is hidden in the skin fold of the lids. With the lower lids, the incision is made about 2 mm under the lashes along the edge of the lid. During the procedure, excess skin is removed and partially the fat pockets after prior measuring and marking of the area. At the end, the whole wound is precisely sewn up. According to requirement, the procedure is performed on the upper and lower lids at the same time or separately, and may be performed independently or with other plastic operations on the face. After an operation on the eyelids before being released, you will be provided with detailed instructions about suitable care and, as the case may be, provided with medicines to dull the pain. You should certainly limit your physical activity for at least a week, as this causes your blood pressure to rise, which is undesirable after the operation. In the first few days after the operation, the lids may swell to a greater or lesser extent, and there could also be small bruises, above all in the area of the lower lids. Your eyes may be more sensitive to light and may water more than usual. For this reason, we recommend you wear sunglasses. Most people are able to read and perform regular activities after a few days.